Hello viewers, wherever you're watching us from, welcome to another edition of your weekly State of Affairs program here on QTV. I'm your host, Aliou Cissé, and it's a pleasure to be back here today. Well, as usual, I'm joined in the studio by my co-host, Sidi Cissé. Sidi, welcome to the program once again.
Thank you very much, Aliou, and thanks for having me.
Wonderful. Today we are looking at the issue of the health sector because, this is a sector that many believe is quite important for Gambians, and recently we have seen controversy, surrounding the health sector with the midwives and nurses association threatening to embark on a sit-down strike due to what they believe their demands are not met. And today we are joined in the studio by Modu Njai, who is the Director of Health Promotion at the Ministry of Health. Mr. Njai, welcome to the State of Affairs.
Oh, thank you very much, Aliou, and thank you for inviting me to this important program.
Thank you so much, Mr. Njai. Mr. Njai, if you have been following the media recently, we have seen the nurses and the midwives association threatening to embark on a sit-down strike. According to them, their demands have not been met. They're talking about the issue of pay rise, and also their welfare is not being considered by the ministry. What's your take on these demands by this association?
Thank you very much, Aliou, and your co-host, Mr. Cissé. Just to say, the nurses at some point raised some concern, and then they wrote to the ministry, raising some of their concerns, and then later they've been invited at the level of this office of the president, and they met the Secretary General, and that was good. They had a very good meeting, and then most of the demand they're asking, key among them is the use of risk allowance, transport allowance, and then also on-call allowance. Some of them we know as a midwife or the officer in charge of a health facility, sometimes they work 24 hours around the clock. So they also expect to have allowance, which is good. And I think what happened is, like, when they put this on the table, the meeting was chaired by the Secretary General and Head of the Civil Service, Honorable Noah Toure, under the direction of the government of the Gambia. I think that's also a plus for the government by calling them, not allowing them to go to a level where they'll be angry and they'll also going to sit down strike, but at least they have been called. And then the meeting was attended by the Permanent Secretary, PMO, Director of Health Services, Director of Nursing Services, and the Permanent Secretary, Minister of Health, and then the executive of the Nurses and Midwife Association. So that was a good meeting. And then when they put these issues together on the table, they had discussions. And then what they have been assured of at the time on the last meeting was held last Tuesday. And then that meeting agreed on that they will consider, the government will consider the risk allowance they asked for, and as well as transport allowance. And then also the issue of the on-call allowance is also going to be discussed on their, because the Secretary General has called them again to go back for them to discuss certain issues, which is going to be Tuesday tomorrow. And then the issue of the on-call allowance will also be finalized, and then something will come out of that, inshallah.
By the way, they should have been on this program today, but then, last minute, we couldn't get them, and, they're not able to be here on this program. We could have been making more interesting to have both parties on this platform to discuss in detail about this whole issue. But then the good thing is that we already know what they are asking for.
Yes.
Mr. Njai, this is not the first time that this body is asking for such. Why hasn't it taken your ministry so long to resolve this issue?
I know, Aliou, we all know health sector has been going through a lot of transformation, has gone through a lot of challenges. And I will tell you, Aliou, that there is no country in the world that can provide health services 100% to the population. And likewise, the staff, in most cases also, some staff we do have, some countries also do register high attrition rate as a result of the fact that staff are not being provided with the enabling environment. Some are not provided with the allowances that they require, they ask for, based on their skills. We all know nursing care is a very important profession. And then as a result of that, government has been trying to look into the affairs. And I'm sure those of the nurses who are working now and then will tell you there is a bit of difference. Those who have been in the system before, if they tell you certain allowances have been paid now, those people have not been receiving those allowances, including myself, being a health public health officer. I've been working in the field Certain allowances I've been receiving now and colleagues are receiving now. My other colleagues in the other position, in the same position, previously were not receiving that. So government is now, what I'm saying, government is reviewing, the ministry has been reviewing the issue of allowances. And I'm sure there was a time, just recently, about 3-4 years ago, they paid what they call, they paid what they call special skills allowance to almost all the profession in the health sector, which is also
Mr. Njai, I think I have to come in here. Let's get
finish. What I'm saying is, like, we all know we are in a developing country. And then, like all other countries, they are struggling with their economies in trying to sustain health. And that, as a result of that, government is also considering improving the human resource capacity of the Minister of Health.
But are you saying these demands are not realistic?
They are realistic. That's why the government have to call them for a discussion, and that has happened.
But how serious is the government as far as the welfare of business is concerned? As I said, this thing has been going on for a quite while.
Let me tell you, government is very, very concerned and very serious about the welfare of the civil servants. And if you look at the press release, one key thing that came out of the press release in terms of increasing or considering the plight of civil servants in terms of salaries and allowances, the key thing that came out was the issue of nurses and paramedics.
Okay, let's get this right, Mr. Njai.
Yeah.
It's like deja vu. Anytime the ministry act because there are demands on the table, you guys never sit back and consider the life and the safety of the staff. One. And two, I think your ministry is very discriminatory compared to other ministries. One fact is, it was your minister who tabled before cabinet for the increment of salaries and allowance for PhD holders. Two. Thirdly, the association came together to make demands not only on allowances, but also the working condition in hospital and the lack of resources for patients. These are serious allegations against your institution.
If you say the minister is discriminatory, I don't agree with you.
No, I don't mean the minister per se, your ministry.
Yeah,
I'm not saying Mr. Njai or somebody, I'm saying your ministry.
The ministry is discriminatory. I don't agree to that.
Okay, why? Because why would you pick left and
what I'm saying is, like, that was a reason why the ministry came up with that idea of increasing the allowance of PhD holders and medical doctors. We all know,
forgetting the frontline officers.
Yeah, I'm sure they are all part of it. Like, for example, what happened was it has been going on stage by stage. But when they brought about issues, the minister decided to forget about it.
Forget about what?
No, forget about this allowance issue. What happened is, like, let me tell you, for example.
Forget about what allowance? Let's be clear. The minister increased allowance for the PhD holders and then forget about
what I'm saying is to forget about the entire allowance issue. He had decided to cancel it.
Even for those on top?
Even for those on top, yeah.
Okay.
That was a good move. Because it has brought in a lot of,
But you increased for the PhD holders,
no, what I'm saying, no, not yet. That has not been
But that has been approved by cabinet.
No, it has been approved by cabinet, but it has not been implemented yet. And no payment has been done yet with regards to that.
It's going to happen?
Well, there are discussions around that. I'm not very sure, but I'm sure there are discussions around that. But let me tell you, we know that the ministry thought of that to strengthen capacity. We know that certain skills people have, they are highly needed in other countries. You and I, you know that. So if you don't motivate them, you don't give them something that will contain them, that will make them to stay automatically. If those environments are not available, they will automatically
But Mr. Njai, let's get this right. The retention,
they will automatically quit.
That is true, but the retention in terms of your staff, you call them the nurses, the doctors and stuff like that, is very poor. You are now considering those on top, but how many of your junior staffs are going to private clinic?
No,
and in fact, are spending more time in private clinic and forgetting the public sector. So basically, before you can deal with the issue here, you must have an overall look at the whole ministry, at the whole capacity of the ministry. I think that is that is missing. Either your ministry is not in touch or your minister is not in touch. One of these things.
Now, let me tell you, the ministry did it purposely just to start. It's the stage. That was the first stage, and the second stage would come and touch other areas.
Without a roadmap.
No,
I will not believe what you said. If the minister is sincere and serious about this, and the minister is sincere and serious, they would have come up with a roadmap But there was no roadmap. All we saw was before cabinet to say, okay, we want to help Aliu or we want to help Mr. Jai and forget about the rest of the people.
You are saying
there is no roadmap.
But maybe you say there is no roadmap. The roadmap could, because if this thing cannot be implemented without a plan.
But we don't know.
No, that's what I'm saying.
Mr. Jai,
you don't
no.
see it. So you cannot just say there's no roadmap.
I don't see it.
No, thank you.
No,
Have you seen one?
But
that I know, as far as I'm concerned, I'm part of the ministry, and I'm sure that there is a plan for that.
But what's the plan?
The plan is to make sure that each and every member
What is
of
the plan?
staff,
What is the duration of the plan? Is it 2-year program? 1-year program?
Wait. The plan will be implemented as we are moving. Within 2 years, we want to see that. We want to see the nurses at this level, the public health officers at this level, the laboratory staff on this level, the pharmacy staff on this level, the medical doctor on this.
This is fantasizing. You are fantasizing now.
No, this is the plan.
No, you are fantasizing because you don't have a roadmap that is before us.
No, that's
Mr. Jai,
yes,
let's be realistic here.
Yeah.
I mean, we all know the advent of the COVID-19 has really exposed the weak health system of this country.
Okay.
What is your take on the COVID response, going by the stories you have been hearing about the COVID?
And when you talk about the health system, for me, COVID has come, it has taught us some lessons, and it has also, along the way, helped us to strengthen capacity, and it has also helped us to strengthen our operations. Before COVID, we were not thinking of having treatment centers, but today, we had both.
Can we get it right? Before COVID, you had Ebola here, and there are supposed to be treatment centers that's supposed to be built, and this never happened. So when you say before COVID, we never thought of treatment centers, I think that is not right.
No, come on. Let me come in. Like what I'm saying is, like, for example, for the Ebola response, we had what we call the isolation centers.
Yes.
Built in along the borderlines, along the borders. Those things are there. But to have a specified area, specifically for treatment of cases for COVID, we didn't have such structures. But now, thank God, we're able to have temporal one. I'm sure when you go into Bansang, just by opposite ITC, you will see one blue building on your right. That's a temporal one. And we're going to have the permanent one at around Pallang, around Wasu, and the construction have started.
So lessons were in land from the Ebola then. If lessons were learned, you would have prepared yourself for something like COVID.
Obviously, we have a plan. For the Ebola, we had the plan. And for the COVID, we also have a response plan. And in all this plan, we've put in exactly what we wanted. Where we think we are weak in the areas of, for example, equipment and capacity, all those things have been identified in the plan. And implementation have started forthwith. And I think this was good. Like, for example, the COVID came, we were able to have, like, for example, we look at the thematic areas. We look at the TOI. We don't want to reinvent the wheel. We look because they are almost similar interventions in time to address them. So we look at the thematic area. We didn't want to abolish any of the subcommittees. We had to strengthen them instead, review them, and incorporate some of the key partners and stakeholders in those committees. For example, case management started training healthcare workers on case management skills. That was good. We also had a thematic area on surveillance. Surveillance was further broken down to laboratory surveillance, and also you have rapid response and contact tracing. That was also done. Staff are trained.
But most of this didn't work. Most of the things you are raising didn't work, Mr.
It worked. Let me tell you one thing. For contact tracing, you go anywhere in this country, any village in this country, our contact tracing teams are there. Our risk communication and community engagement teams are there. These are the Red Cross volunteers, youth volunteers, Minister of Health staff, combined together to form committees at regional level.
Mr. Njai, no, I do not agree. Let me give you an example. Let me give you one example.
Okay, go ahead.
And I'm on record for this.
No problem.
I had a member of my staff, because I make sure there are routine tests for some member of my staff who are at front line in terms of the TD area.
Yes, sir.
And this chap, I took him to Kotu and was positive, right? And what's supposed to happen was for him to go to the treatment center, because that's what they agreed, because he's living in a family setting. And when he went to the treatment center, there was nobody to attend him. It was just them band clinic. And this guy, unknown to me, he left and went home. So if you're talking about contact tracing and all this didn't work, I mean, there's something fundamentally missing
what you
here.
are saying, I'm not sure whether that is the case with our treatment center. No way.
That is the case.
What I'm saying is, in our treatment center, some people will go. We'll have some experiences. Some will go there, and they'll be asked to stay in that place for the period of their treatment. You know what they end up saying? I cannot stay here. I want to be on my own. Yes, we will also tell you the areas we have identified for people who want to stay there whilst they're undergoing treatment. And those facilities, they have to pay.
You mean Dembani, the patients have to pay?
Dembani is free.
Yeah, that's what I'm saying.
No, what I'm saying is free.
Yes.
But when they go there, because they just don't want to stay there because they feel like...
But there must be an enforcement. This is... you have
monitoring as well. You should be able to monitor.
No, that's what I'm saying.
What's happening at those
if we listen to each other, we're going to have a very good discussion.
No, we are listening.
No, thank you. The treatment center, as I tell you, we have security. And every time they have staff 24 hours. And there are doctors who are there 24 hours.
But Mr. Njai, we have seen patients, we have seen COVID patients. No, let me get this right. We have seen COVID patients who left treatment centers. They left because you don't have the security in place to actually enforce this thing.
We had that challenge.
I read an article not long ago.
We had that challenge.
I read an article not long ago when one chap here, the Sarawule newsreader, or is it in QTV, wrote an article when he went on Demban as well. They stayed in Demban, no bed seat, dust, all sorts of things happening there. And these are on record. These are on record. So if you are telling me, I don't think your ministry actually was monitoring activities at these treatment centers.
No, actually the monitoring is ongoing. And then the team that are responsible for case management are really doing their best to ensure that they satisfy the needs of the patients that are already admitted there.
Now, Mr. Njai,
wait. But as you know, in the era of this social media, people can sit anywhere and come up with a story, come up with a video, come up with an audio, and say, I have gone through A, B, and C. When actually, it has happened several times. People complain and make certain claims. When we went to find out, we didn't realize that those people have never even stepped their foot in that particular place. So people can sit somewhere, make stories, and then share it.
But
they have the liberty to share.
The fact is, you might have all those, laid down procedures or protocols, as you will put it.
Yeah.
But when it comes to implementation, the practical aspect of it is a quite different thing.
I think that one, I don't agree with you.
We have seen many people who were taken to these treatment centers, and even the food that they were served there, and even the manner in which the food was being served to them wasn't dignifying at all.
Well, I think it's important for people to come out and tell us where. We as a ministry,
they've done that.
No, we as a ministry, some certain things they might say. Yes. I'm not sure those things are happening in our facilities.
I just said to you what two people experienced.
No.
One I was an eyewitness without no bed seat. It was after the big Hamatan win. Okay. My God, I had to just get out of that place and just throw my clothes in the washing basket because that's how dirty the place is. And you are saying that did not happen?
I don't.
And we have a chap in this very building here
I'm not sure.
who had a terrible experience there.
I'm not sure. I don't agree. No, seriously, because if you go to a treatment center now,
why would you think
if you go to a treatment center now, what you mean now? No, what you say now and what you're saying.
Okay,
and what's happening there is quite different.
Why do you disagree with the facts?
No, but the thing is,
I had a program with you here. I saw you, one of your test centers in Brusubi, so dusty that it has not been touched.
But alhamdulillah, today, after that discussion,
yes.
I mean, you know that we all support each other to make sure that the place is clean.
Why should it happen? Why should it happen after the discussion?
We occupied newly. That was the time you went there. When in fact we started with
let's move on. Let's move on, Mr. Jai.
Allow me to come. Okay, now.
We didn't use the whole building. We started with only one unit.
Okay.
So you went to the whole building. So how can that be compared?
Okay, now, Mr. Jai, I know you wouldn't agree with most of these points.
Yeah.
But now, in your opinion, what will you identify as a failure as far as the response is concerned?
I don't think
because you can't tell me everything was perfect.
No, I will not say that the word failure I will appreciate. We didn't fail in any aspect. There are some challenges here and there which are really beyond the Minister of Health.
What are those challenges?
Because
what are those challenges?
At some point, I know that we had challenges with internet facilities in trying to help us to do to facilitate the data collection and also to make sure that the people get their results on time. That was a challenge at some point that we have gone through that. We also, at some point, we also had challenge with electricity. We know that, but thank God IOM came to our aid, and then they helped the laboratory with a generator. So that when at some point Naveg used to go on and off, and then we had a challenge, and that was just a short period, but at least on some time that was a challenge. And some people picked that one as an issue to say,
okay,
this is that. No, wait. So when we got the generator now, and we also got computers now, and now internet has been installed, those issues are addressed. But for operations, our challenge is here, for example, people are a bit hesitant in terms of getting vaccinated. I'm sure even Mr. Cisse is not vaccinated.
We'll come to that.
Allow me to come.
Wait.
I'm making mine.
No, because these are our operational challenges.
Yes. Now, you talk about issue of internet and data.
Yeah.
At some point, there was a media report that one of your laptops with the data was stolen. What happened to that story?
You know,
have you been told?
I'm aware of that one. That was the beginning of the response. I think that was a long time now. We all know what happened at Westfield. This guy was driving, the traffic was very slow. Somebody came to where he was driving, talking to him, never knew that somebody was also at the other side opening the door. That was what happened.
So he did not lock his door while he's driving.
And what happened next?
No, what happened is like,
this is a very sensitive data in that laptop.
At least you know what happened? Most of the data that people are talking about, we got all the data. He was sending them by email, and some of the data that was sent by email were all retrieved.
But someone can still access it somewhere else.
I'm not too sure.
Okay, Mr. Jai, let's look at this. I need two fundamental answers from you.
Yes, okay.
One is, what is the worst case scenario, the state of affairs as far as COVID-19 is concerned now? And my second point is, I think God saved the Gambia. If God had not saved us, I do not see anything that the ministry has done to help us to actually withstand the COVID in this country. One, when you look at the surrounding, Gambia has the worst percentage in terms of people wearing masks. When you look at the surrounding, Gambians were coming together, a lot of social activities, a lot of political rallies. It's like everything was loose. So the powers that you have put out there, that this is what you can do, it never happened. So you see, basically, what we have seen in the Gambia was a laissez-faire attitude from those on top and the laymen and women in the streets. This is fundamental. So where do we go from here?
I think Mr. Cisse, you are coming back to what we have discussed some time ago.
I mean, whether we've discussed it before,
we discussed
the fundamental issue
No, but he just want to bring you back because it has to be clear.
Where do we go from here? Where people don't wear masks, there's very less percentage in injection.
We know actually what the government can do is to put up measures.
But the government themselves don't respect those measures, Mr.
Allow me to talk now.
Okay, no problem. Yeah, okay, go
you say we are talking. Now we are talking. When I'm talking, allow me to talk.
You talk now.
Okay. The government put out measures.
Yes.
Advise people to put on masks.
Yes.
Advise people to put on to ensure that they wash their hands and to observe physical distancing. You all know, in most of these meetings we are talking about political rallies, you see people put on a mask. But go to the streets. Those people who are
putting masks.
Oh yes.
But how can you tell people?
No, QTV can bring in some.
Let me make this clear. Mr. Jai, let me make this clear.
No, wait, Mr. Cisse.
So you say social gathering. It's been banned. It's been banned. So how can they come together again? We are saying
at the period of the ban of the social gathering, there was no social gathering.
There were social gatherings.
Where?
All over the place.
No, I mean,
the president went on meet the people's store. The president went on meet the people's store.
No, now you started. You brought.
No. You said it never happened.
No, because what happened? I want to bring it back to him.
Mr. Jai is just being in denial. He
no
doesn't
way.
want to accept anything.
You see, the thing is.
So you said no gathering happened. We saw President Barrow with hundreds of thousands of people.
I was part of the tour. I was part of the presidential tour.
You were part of it.
I was part of it.
So did it happen?
What I'm telling you is, we make sure that the people observe the precautionary measures. The president himself was sanitized every time, every minute, every gathering he entered. He himself will even ask for the sanitizer.
But how about other people?
All other dignitaries around. I'm telling you this.
What about the supporters
and
the followers?
Bring your videos now. Bring your videos. Bring them now. We will see it. No, bring the videos.
No, Mr. Njai,
president
Mr.
no,
Njai,
I want to prove it to you.
Mr. Njai, let's get this right. I want to get
Let me tell you this thing
I want
now.
one simple answer from you,
No,
Mr.
you see,
Njai.
but if you don't allow me to complain now, I will also not allow you to play.
Allow him.
Let me conclude.
Okay, go ahead.
Go ahead.
You see, Ali, I can see you are not a very good referee.
No, go ahead.
But the thing is like,
no, the thing is that because
It's not a referee here. Mr. Njai, go
so
ahead.
what I'm saying is like,
okay.
during the tour,
Yes.
we make sure that our team were there to make sure that everybody put a mask. If you want to deny, bring the video of the tour. We will prove you. I prove you wrong.
Okay,
But-
okay, let's get this
And
right, Mr.
again-
Njai. No, let me get this right.
Again,
Well, at
again.
the time there was state of public emergency here.
at the time,
Yeah,
of
at the time
tour-
when the president was going on tour. Yes.
No, that was no state of emergency.
Ali, it was.
No, it was not. It was not. There was no state
So-
of public emergency
But
at the time.
what happened
At the time.
But then you're talking about people
They were
that,
relaxed in
No,
the...
Mr. Njai,
in
Mr.
the-
Njai.
Not in the public
the-
gathering.
Mr. Njai,
No, they were relaxed in the...
It was in the
response.
pandemic.
No.
Mr. Njai,
I don't agree with you.
you're talking about the issue of you're talking
It
about
was
people,
within the pandemic. It
Mr.
was,
Njai.
and there was a
but
state
the
of
thing-
public emergency.
The state of public
Sidi,
emergency
Sidi.
was on stages.
Can I come in here?
At the time, there was a relax in the
Mr. Njai, Mr. Njai,
in the
Mr. Njai.
state of public emergency.
Mr. Njai,
That was the
Mr. Njai,
truth.
Mr. Njai, Mr.
Yes,
Njai, let me
yeah.
come in. At the time, what we were advocating was for people to wear masks, wash their hands, and of course the issue of social distancing was something that you have always been emphasizing.
Sure.
But there was no social distancing during that tour.
Okay. That could be observed, and then I know that when you bring people together, it's difficult. But when we make sure that mask wearing was compulsory during the tour, it was compulsory.
Well, Mr. Njai, I want to get this
was
right from you.
compulsory.
And please, just
Yeah.
look at me and answer this question.
Yeah.
At the time the president was going on Meet the People's Tour, we all knew from experts, scientists, there's a second wave coming. Is it incompetency from your ministry to say to us at the time you have relaxed some parts of the state of public emergency when we knew the second wave was coming? Is it incompetency from your ministry?
I don't think that word incompetency is something that I will appreciate for now.
Okay, well, what was the problem?
I think
Okay, I
what
accept
happened is
that.
like, I think you need to withdraw that word now, because for me, that,
But you are telling me-
No,
Okay,
because
okay,
what happened
okay.
is like,
Okay, address
the
it,
ministry
address it.
knows what it was doing at the time.
But second
No,
wave
wait.
was coming.
No, ministry
Sidi,
knew
Sidi,
exactly
Sidi,
what
Sidi.
it was doing.
Okay.
Ministry sent reminders. Ministry sent messages to people. And at the time you are talking about, people were very serious with regards to observing the precautionary measures at the time. It is just now that people are a bit relaxed when they see figures going down.
No, Mr. Njai.
Wait.
The second wave was at the corner. We are talking about it. And we knew after the Meet the People's Tour, we had a second wave in this country. You are telling me your
Was
ministry
it-
did not look ahead.
Ministry,
Inward
we
looking.
know, let me tell you, the ministry provide technical guidance for people to follow, and those guidance have been provided. And then we have various committees that meet.
So you are saying
Wait.
the ministry advised. Did they say they are okay?
Wait, what I'm saying is the ministry advise if this A, B, and C can be available, it's okay. Because one, people need to put on masks, people need to make sure they wash their hands at all the time with sanitizers, and also they also observe physical distance. At some point, even the sitting arrangements were all being observed during the tour. I was there.
But Mr. Njai,
I was there.
Mr. Njai, I was
And
on the
you
tour.
were also
I
there.
was on the tour. But then
look at the sitting arrangements.
No, listen, I was on the tour. If
Yeah.
you're talking about the issue of face masks and sanitizer, that's perhaps for the president's delegation. But
No
the
way.
locals, the local people there.
I don't agree with you.
No,
because you were there, I was
Yes,
there.
I was there.
But you know that
I was
if
a
you look
live
at-
witness. You
Mr.
was an
Njai,
eyewitness.
Mr. Njai,
I'm also
I
part of
was
the
there,
process.
and I'm telling you from what I've witnessed.
Okay.
So many people who came to those meetings were putting on masks.
Ali.
So,
They
Mr.
were
Njai,
in.
Mr. Njai,
You'll even be surprised that even the
Honestly.
communities themselves were even providing masks to visitors that are coming to that community.
so you said you
But they
provided
weren't-
technical advice.
They weren't
huh?
using it.
You said you provided technical advice. That was the
The
role of the
message is-
ministry.
Yeah,
No,
you
let's
see,
get
yeah,
it right.
message
Let's
is
get it
advice
right. So
on
when you
wear
were
your
giving
mask,
advice,
wear
when
your
you were
mask
giving
and-
advice, were you certain that we should go ahead with the Meet the People's Tour on the condition of wearing masks, knowing that there's hundreds of thousands of people going to be gathering? Nowhere, as a health person, would advise for such a gathering to go. I know if it happens, it's only Gambia, and it will go on record. It will go on record.
I want to tell Sidi that whatever decision the ministry does is in consultation with the executive. And then the advice given is that people should observe the precautionary measures. They should make sure that people put on face masks. And that's the responsibility of the Minister of Health. To make sure that people wash their hands regularly and also to observe physical distance. This has been our message. And the minister, anytime he stands on the podium, you can be, he hammered on these messages.
Okay, but are you guys the ministry? These are the reminders. You are saying now to us, to the general public, all the viewers, that the ministry, whatever they do, in consultation with the executive. Is that what? Let's have that on record.
Obviously,
but you guys are the. Let me land.
Why I'm saying this? Yes, there is a national health emergency committee chaired by the Honorable Minister of Health. We also have the cabinet subcommittee chaired by His Excellency the Vice President. And no decision is taken at the ministry without them knowing what is happening.
Are you informing them or you are doing consultation? Because you should lead. You should not be the followers. You are the experts.
Now let me tell you, in anything, no matter what we are the expert, for example, we should also consult. Consultation is not bad.
So these committees are part of the executive, right? If you don't
consult, you can have problems.
Okay, to get it right, these committees are part of the executive.
The vice president is part of the executive.
Now I understood.
So if she leads a subcommittee on cabinet,
there are other members,
and the ministers and other members are part of the cabinet.
Okay.
And also likewise, also at the ministry level, we have a multi-sectoral committee, National Health Emergency Response Committee, chaired by the Minister of Health, and with this also comprised of almost key government institutions and then civil society and as well as the UN agencies. We also have what we call the daily coordination meetings. Also been chaired by the Permanent Secretary.
So just to conclude, and then Aliu to come in here.
Let me tell you, these suggestions, recommendations are sometimes taken from the lower level to the next level, to the next level, to the next level, and then feedback also comes like that.
I want you to help me.
In this case, you start from the bottom.
Normally, all
but when it comes to allowance, you start from the top.
No, Aliu, don't change the story.
No, I'm just trying to
change the story.
I'm just trying to compare the two, Mr. Njai.
I said this here. If you want to retain highly qualified staff, they need to be motivated.
That's statement.
This is the thinking of the ministry. That these are people who are with us. They might be needed somewhere else. When we don't motivate them, they will go.
No, but Mr. Njai, there is no denial of that. Don't forget the foot soldiers, the nurses.
They are very important. Let me tell you, everybody in the health sector is very important. And the ministry is aware of that. The driver, the cleaner, the one doing laundry, the cook, the nurse attendants, the SCN, the CHN, the midwife, the SCN midwife.
Mr. Njai,
the public
let me conclude on that statement.
I'm just giving you this thing.
No, I understand.
Everybody
is
important.
They are important.
And our human resource director is working very hard.
Okay, I understand
and we have a database where each and everyone will be supported. And let me tell you.
I want to get your expertise knowledge here. I want to ask an expert. No, Mr. Njai, let me get this right.
No, I will not agree with that. Wait, until when I'm done.
Okay.
The government is very, very much concerned with these people.
Okay.
With all the entire health system. And then the nurses are going to be provided. That's why the Secretary General listened to them. And the use of risk allowance is going to be considered.
Okay.
The use of transport allowance is considered. And what is on the table for tomorrow discussion is the on-call allowance. And I'm sure whatever comes out of that, perhaps when I come back here again, I will tell you what.
Okay, now get me a post-mortem. CD, allow me to come in. Okay. What is the on-call allowance as we speak?
As I speak to you now, I will not be able to tell you offhand. I cannot remember it.
They say $200.
I'm not too sure.
$200 per month.
I have no idea about that. Maybe I could have got. I will get that data from the
Mr. Njai, I need you to help me here. Yeah. As a medical expert, when you guys knew fully, we have to come back to this. The second wave, and the president went away on Meet the People's Tour. Let me come. That was the biggest gathering we had at the time. And after that, when he came back, our numbers start going high. So was that not the recipe for the surge in COVID cases?
Let me tell you, at the end of the tour, do you know at the time, borders were also open.
So it's the borders, right?
No, wait. We cannot just point fingers at one particular issue. Borders were open. Countries open up their borders, free up, and people are moving.
Okay.
Airports were open. And we started having cases coming from the airport. Most of the cases, most of those cases we had report at the time were mainly travelers coming into the country.
Was that a wise decision?
And as a result of the quarantine, and that's why we didn't joke with quarantine.
Was that a wise decision to open the borders at the time?
At the time was not a decision only for the government of the Gambia. It was an ECOWAS agreement that countries need to open up. And flights started coming in. I think I remember when we had those things.
So we had no say. We had no say.
We are part of the body. We
are a sovereign republic, Mr. Njai.
No, but we are part of the body. When ECOWAS, we are part of ECOWAS, my brother.
No, man, come on. No, Mr. Njai, you cannot tell me.
Yes.
Listen, you cannot tell me when ECOWAS say we should turn left, we should turn left.
No, but actually,
we are a sovereign country.
If you look at the
our risk, our risk has to be measured. Listen, our risk must be measured.
No, but
we know how fragile our hospitals were.
Let me tell you, people have also been sitting for long. They need to travel. They need to have goods need to move. That's what they consider. Goods need to move to the people. And certain goods are in, for example, in Gambia. They are not in Senegal. They have to move. Certain goods are in Senegal. They are not in Gambia. Likewise in Guinea-Conakry, in Mali, and Burkina Faso, for example. They have to move.
People have to move. Goods have to move. Yeah. But it must be balanced. It must be balanced here.
And the health of the people is important.
The life of people is very important. That is why everywhere at those movements, we also strengthen our surveillance system. And let me tell you what the ministry did was to set up a special meeting 3 days in a week on surveillance meeting. Just to look at issues, address them, and this meeting is also chaired by the Honorable Minister of Health. The whole idea is just to make sure that whatever is happening, we make sure that we strengthen on surveillance, because that's the key at the time. And even now, surveillance is very, very important, because when we don't do surveillance, we will not be able to know where we are as a country. And that's why that was that was strengthened and followed by quarantine, because we know when people come in, we cannot.
Okay, I guess Ali will want to come on here.
Yes, when they come in, they have to go through the and then I'm sure some of you were complaining to you that I came from the airport, I've been picked up from the airport, I was taken to
I don't want to go. I don't want to spend all the time. Mr. Njai,
we will get you and take you to quarantine.
Mr. Njai, I would like Ali to come here, but you talked about the airport. Let me come back on that. When I get to the airport at Yundum, I'm frightened to death.
Why?
No measures. It's actually, sure? Of course, I can take you right now. We go there. You'll be surprised. Even the drum that is provided by UNICEF, the blue drum, my God, the amount of sand inside it can lay 6 blocks. The dust that's been carried from the sand can lay 6 blocks.
There's
no social distancing.
That is not being used.
What do you mean it's not used?
Have you seen the public officers there with the sanitizers?
No.
No way. That is
when you are coming in.
Yes.
When you are coming in.
Now moving forward, Mr. Njai.
The water tanks.
I'm happy that when you are coming in, you see that.
A lot of thousands.
That point is clear.
Okay, now, Mr. Njai, moving forward, before we get to the national health policy, not long ago we have the Afrobarometer releasing their findings, and then where we have seen so many Gambians, believe in prayer than taking the vaccination. Are you worried in any way by these findings by the Afrobarometer as far as curbing the COVID-19 is concerned?
Let me tell you, I listened to that study, and I know behavioral studies sometimes it will be difficult to generalize, and then the statement was generalized. We don't know the sample size. We don't know who are involved in the study. And then that is their feelings, those people who feel, perhaps those are the people they met. But let me tell you what is happening in the community. Are you denying it? I'm not denying anything.
Yeah.
I'm not denying anything.
Are you questioning their integrity?
I'm not questioning in their integrity either. Okay. But what I'm saying is, I have no idea about the sample size.
So when this thing...
Okay, now see, allow me to come in.
I'm coming. Can you allow me? Can you allow me, Ali?
This is a highly reputable body.
I know, I'm very fine with it. Now, when people say to them prayer is more important than the precautionary measure, that is their feeling. There is a qualitative study.
Belief.
That's the belief that this is what is happening. But it's a qualitative study. Whatever, there is no wrong or right answer in qualitative study. You either, whatever you ask, you just say whatever you want to say. And that's the belief.
But
so Mr. Njai, do you believe that many COVID cases have never been reported to our hospitals, to our treatment centers?
It's all
simply because they do not have confidence and trust in your establishment. Many sat at home to look after themselves, take the home remedies, and that is more than the numbers you have seen. So there is an issue of competence, in terms of...
Now, let me tell you, when it comes to competence and also being equipped and also being a model in the region, Gambia is one of them, one of the countries, in terms of healthcare service delivery.
For real?
Let me tell you, yes.
For real? Who did the survey?
I am telling you.
Who did the survey?
I am telling you. I am telling you. Ali, you travel.
I travel. That's true.
But in Gambia, you can work.
When we are spending...
Wait, let me talk. I will not listen to you. I will not listen to you.
It's an opinion of yours, right?
No, let me talk now.
When Gambia was struggling getting a test result in 72 hours, 48 hours, other countries are doing it in half an hour. You want to tell me your case is test case?
Which countries are that?
Come on. Senegal, for example.
Senegal started the way we also started.
No, I'm saying,
that's it.
when you are doing 72 hours...
We didn't have the equipment.
Oh, look, Mr.
We didn't have a laboratory. Now we had a laboratory.
Listen,
and we are doing it.
Look at the number of tests you've been conducting in this country. It's like zero compared to other countries.
But have you been tested?
Several times.
Yes. Because you are traveling.
No.
You didn't sit down.
I volunteered to go to Kotu.
I know.
Okay.
Because he's traveling, he has to test himself.
Okay, now.
The use of voluntary testing is something that we have been encouraging. You know that. What I said was like in the sub-region.
Mr. Njai,
I have traveled, crisscrossed the whole of the sub-region. It is only in Gambia that you are sick, you walk to the health center, you get your prescription and you get your drugs and you go home.
You get a prescription drugs. You get prescription, but no drugs.
And get your drugs and go home.
No drugs, no.
Mr. Njai,
My friend, let me tell you.
Mr. Njai, that's an opinion. We live in this country. We have traveled in this country. We have seen what people have been experiencing.
You've gone to so
No,
many
listen,
countries.
allow me to come in.
Okay.
Allow me to come in. Most of these health facilities in the provinces, they're sort of going to pharmacies. That's where they get their medication.
Are you sure?
That's the fact. Mr. Njai, we have
a period. Let me tell you, we have a period.
Mr. Njai, we have seen...
I know COVID. No, wait, Ali, I will not listen to you now.
Mr. Njai,
when we say COVID came at the time, we all know. Supplies have been a challenge. Countries have found it very difficult to get supplies delivered because of the restrictions in terms of airfare, freight, for example. And that has created a gap in terms of delivery of supplies. That one we all know. That's a challenge. It's not deliberate by the ministry. That's not.
But this has been here well before COVID-19 came in.
Are you sure, Ali?
Yes.
No, I don't agree with
Yes.
Now, because what happens is like, in our health facilities.
I have experienced not once,
why is it
twice.
That people are traveling?
You go there and they'll tell you this is not available in the pharmacy.
Traveling miles and miles from other countries and they come to Gambia for services. Why? Because of the confidence they have in our staff and our facilities and also what we are providing.
Mr. Njai, the reality of the health sector in this country, you and I know, okay? Whether you'll sit here to defend it or not.
No, I'm not defending anything, seriously.
But one thing is very clear. All these parastatals in this country have what is called private health insurance.
Yep.
Where do they go? I ask you.
No,
where do they go with their private health insurance?
No, they go to private clinics.
Why?
Why do they go to the private clinics?
Because the companies feel that they can provide the service and they can provide and they can pay.
No, because they don't have confidence in your system.
Alu,
that's the fact.
We are also working on the National Health Insurance Scheme.
Okay.
And I don't want to talk about that. I will just wait until.
And this is for who?
I will also keep that one for now. Because
but is this not alarming?
The National Health Insurance Scheme.
Mr. Njai, is it not alarming?
Most of our problems.
Is it not alarming that all our parastatals here are always eager to create a sort of an insurance scheme for their staff because they believe for delivery, efficient delivery from their staff, they must be well enough. And they cannot get that service from your clinics.
Let me tell you.
And again, we have seen ministers, directors, head of institutions who would fly out of this country for treatment. That is something that we need
I know
to
most
ourselves.
people.
And this has been happening. This has been happening since.
I know for you. I know when you go to a private clinic, most of the time you end up in a public facility. I know.
What do you mean when I go to a private clinic?
You know. I know what I'm. He knows what I'm talking about.
Private clinic. What do you
most of the time, private clinics, people go there, they get what they are supposed to get, but at some time when there are challenges, they end up in our public facilities.
But why do they have to go there in the first place?
Where?
Why do they have to go into the private clinic in the first place?
I don't know.
No, but
the people want to show that they can afford it. But I know in our facilities, our equipment, our charges are very minimal. Wait. Our charges are very minimal.
Mr. Njai.
Affordable to each and every Gambian. Our services.
To get a ticket.
To get ticket what? To get
You
your
don't get
drugs.
listen.
No, but
Antibiotic, you get your antibiotic, you get your...
Mr. Njai, I
Yes.
disagree. I disagree.
Okay,
with you.
Ali, now come in.
Most of these facilities you are talking about, I can say we only have the structures there. A month ago, I was in Nyami in Agesadi.
Okay.
They have this community clinic there, which serve almost over 11 communities. They have only one nurse there.
Okay, good.
Believe it or not, they have only one nurse there.
Can I comment on that?
And even drugs is a problem.
Okay.
Mr. Njai, we were both on the president's tour.
No.
Anybody who spoke at that meeting will say, we need more medical personnel.
Yeah, that's true. And more
We don't have enough medical
and
personnel.
drugs.
You know why? Because there's no motivation.
Yes.
No.
Most of the people, they don't want to go to the provinces. There's no hardship allowance.
Now you are coming. They don't want to go to the provinces.
Because of the lack of motivation.
Now, let me tell
right now,
you-
even those who are in the coast here are complaining.
No, I think the ministry is really considering each and every staff of the Minister of Health.
Okay.
Let me tell you this. Why you mentioned Gisadi is a health post. The ministry is now working on to improve that, to upgrade it to a functional community clinic. Likewise, Buduk, Kisemajao, and others. These are the areas that we feel there are gaps. Why? Because, for example, Gisadi, it has a lot of clusters, about 11 communities or so.
Yeah.
And then they travel to Dankunku. And we know that the distance...
Which is almost 7 kilometers
Now,
from
wait,
Gisadi.
Aliu, I'm coming. You know, there's a bit of distance in that one. So that place is going to be a functional community clinic with a midwife, like that of example of, for example, this one of the villages in North Bank.
Okay.
I mean,
I think this is part of your
is exactly
national
what-
health policy, yeah?
No, in fact,
2021,
This is
2022.
the plan for the ministry.
Okay, we understood that. Since
To-
you are not
to upgrade-
presenting that plan here, can we move on,
to
please?
upgrade certain health posts to functional community clinics, and to upgrade certain community clinics to minor health centers, and to upgrade some minor health centers.
I did
to
ask
major health
earlier
centers.
on
So
a
this is
very
what-
important question.
Yeah.
What is the worst case scenario as far as COVID is concerned? Other countries looking forward, other countries are planning and are putting other measures. We in the Gambia, we are sort of like reactive to issues. In India, we saw what is happening there.
Yeah,
And
quite-
we
quite-
saw,
quite-
you know,
quite
other
well.
countries are in fact banning flights from India, travelers from India.
Let
I
me
mean, we in the Gambia, we do not know as at now what is the next step as far as the vaccine is concerned, what is also going to be happening. I mean, is life going to go to normal? Is Gambia also talking, you know, within, you know, the ECOWAS community or within ourselves to see whether we're going to introduce a vaccine certificate, for example? So these are things that we need to know, Mr. Njai.
Okay, thank you very much. I think I'll be very happy if you listen to me now.
Yes,
for me to
you can go
clarify.
ahead.
No, I'm
We're
listening.
running
Now,
out of time.
In the
so you
African region,
Okay.
we all know that they are dropping in cases because countries have started using the vaccine. People have been vaccinated. People are demanding for the vaccine. People are demanding to be vaccinated.
Not in
In
Gambia?
Gambia?
Well, I'm coming.
Okay.
In Gambia, we are doing the same strategy. Our first strategy was we ask people to go to health facilities to get vaccinated. But you and I know from 1978 to now, when we started doing our campaigns, yellow fever vaccination campaign, we have been going to communities. The ministry have been going to communities. And we did what we call the caravan, COVID-19 sensational caravan. This caravan went to every community in this country. Every region, they organize their team and they go to every community. And when they did the sensitization, it is the communities now that are asking to be vaccinated. So what we are doing now, we are sending teams to those communities now.
Do you have figures for
Figures, yeah.
these things?
For the vaccination now,
Yeah.
we have 22,000, I would say 833 people have been vaccinated now.
Age-wise,
As of 27,
age-wise, what are the ages? What are age?
mainly age of
Elderly.
65, elderly people, people with other underlying conditions.
But
And as well- yeah, I'm coming, Alu. We might even go down to the age of 40.
Okay, but we are not there yet.
In fact, you and I, if you want, you can get vaccinated.
No, no.
For your safety. Because what happened is like, in the next one week,
what I want to
in
know,
the next one
Mr.
week,
Jai,
we are going to
Mr. Jai,
exhaust our
Mr.
stock.
Jai, Mr. Jai,
Yeah.
let's get this
We are
right.
going to
These
exhaust
are-
our stock for
These
time.
are very important issues here.
Exactly. But can you allow
When
me
you
to
start,
finish
no,
now?
no, no. I
Say,
want
say,
this to
say,
get-
say, just
but let
because
it-
Allow me,
we're running
allow
out
me
of
to
time.
finish.
Yes.
Allow me to finish
Okay,
this
yes,
one.
we're running out of
So
time.
we know
please.
vaccination is very important and it works. We were advising people to get vaccinated, and that's you ask about when are we going to normal. It is people have to comply to the to observe the precautionary measures. That's one, alongside with vaccination.
How many percentage do we have to vaccine for us to go to normality?
Well, I think
A million people in the Gambia?
I think something like close to a million, 1.2, 1.3 million. When we have that, I think.
And how long have you done this vaccination?
This is just since March.
Since March, you already got 22,000.
And guess what, Mr. Sidi? We got 36,000 doses, and you are talking about just 20-something,000. Since when? You're going to even cover
let me tell you, this vaccine by the next 2-3 days it will be exhausted. I tell you this. Because people, the demand is so high now.
So when is exhausted, what is going to happen?
Now we're going to get more vaccine for the second dose, for the people who are supposed to get their second dose. We are now working on, you and I, you
by now you should have the second dose here.
No, the second dose should not be a problem, my brother.
It should not be a problem.
No, because we get the support of the partners. UNICEF,
but is it not 8 weeks? Is it not an interval of 8 weeks?
No, it's 8 to 12 weeks. 8 to 12 weeks.
Mr. Njai, we're running out of time now. Yeah. Your final message to the nurses and midwives, just briefly.
No, I just want to tell them they are my brothers and sisters, they are colleagues, we are working together. And then I want to assure them that the ministry, together with the government of the Gambia, that's the Office of the Secretary General, we really consider their plight. And I'm sure 2 areas have been addressed. That's the issue of risk allowance and as well as transport allowance. And for the issue of on-call allowance also will be discussed on the table. So I just want to ask them to just stay calm for a while until
thank you so much.
Discussion starts.
Anyway,
well, thank you so much, Mr. Njai. Well, viewers, with that we complete this program, State of Affairs here on QTV. I was your host, Aliou Cissé, with my co-host, Cissé, and our guest tonight was Modou Njai, Director of Health Promotion at the Ministry of Health. Thank you so much for watching, and do join the repeat on Sunday at 10 a.m. Bye-bye.